Yellow toenail isn't fungus. It's your body sending you a warning. Take off your shoes for a second. Go on. Now look at your toenails. If any of them have gone yellow, thickened, or started pulling away from the skin underneath, I want you to genuinely pay attention to what I am about to say, because the assumption almost everyone makes in that moment, the one your friend makes, the one you probably made yourself, is that it is a fungal infection. You grab some antifungal cream from the pharmacy, you try it for a few weeks, nothing really changes, and you quietly accept that you just have bad toenails. And here is the problem with that. In a significant number of cases, yellow toenails are not fungal at all. They are your body sending you a signal about something happening much deeper than your feet. And when that signal gets missed, the underlying condition keeps developing silently for years before it becomes something far harder to treat. Hi, I am Dr. James Whitfield. I am an emergency medicine physician, and I have been working in the ER for just over a decade. In that time, I have treated more than 40,000 patients, and what I see every single day are people arriving in front of me with conditions that had warning signs for years before they became emergencies. Conditions that showed up quietly in places people did not think to look, sometimes in their nails. This channel exists because I believe prevention has to come from you, not from a healthcare system that only meets you at the crisis point. My job here is to give you the knowledge to act before it ever gets that far. In this video, I am going to explain what is actually happening inside your body when a toenail goes yellow. I am going to walk you through the real list of causes, ranked by how often they are missed. I am going to give you a clear way to tell the difference between a fungal nail and a nail that is signaling something systemic. And at the end, I am going to give you a practical framework for what to actually do next, including when you can handle it yourself and when you genuinely need to be in front of a doctor. Stay with me to the end because the framework is the part that most videos skip entirely. Before I get into it, one quick ask. Only a fraction of the people watching this video have actually subscribed to this channel. Everything here is free, medically accurate information designed to help you catch things early. If you find this useful, please, please, please subscribe. It takes 2 seconds, and it helps this content reach more people who need it. I promise to keep making the most genuinely useful videos I possibly can. And if you get to the end and did not learn something new, feel free to unsubscribe. No hard feelings at all. All right, let us start with the foundation, because to understand why toenails change color and texture, you need to understand what a nail actually is and what it depends on to stay healthy. Your toenail is not just a dead plate of keratin sitting on top of your toe. It is a living structure fed by blood vessels, maintained by specialized cells, and dependent on a constant supply of nutrients, oxygen, and healthy circulation. The nail plate, that is the hard visible part, is produced by cells in the nail matrix, which sits just beneath the base of the nail under the skin. Those cells divide constantly to push new nail tissue forward, and they require a steady blood supply to do that properly. The nail bed, the tissue directly underneath the nail plate, is richly vascularized. That means it is full of tiny blood vessels that give healthy nails their pinkish color. When anything disrupts circulation, nutrition, lymphatic drainage, or immune function in a sustained way, the nail is one of the first places it shows up. Not immediately, slowly, over months, which is exactly why it gets missed. Now here's the real problem with the "it is just fungus" assumption. Onychomycosis, that is the clinical term for fungal nail infection, is genuinely common. It affects roughly 10% of the general population, and the rate climbs significantly in older adults. So the assumption is not crazy. But here is what becomes clear when you actually look at the research. A study published in the Journal of the American Academy of Dermatology found that even when dermatologists clinically diagnosed a nail as fungal based on appearance, laboratory testing confirmed fungal infection in only around 50% of cases. Let me say that again. Roughly half of nails that look fungal are not fungal at all, and yet most people, and honestly, many clinicians in a time-pressured setting treat based on appearance alone. That means a huge number of people are taking antifungal treatments for months, sometimes years, without any benefit, while the real cause goes unaddressed. So what are the non-fungal causes, and why do they matter so much? Let us go through them in the order I want you to understand them. The first and most important systemic cause is peripheral arterial disease. This is the condition I want you to really hear. Peripheral arterial disease, sometimes called PAD, is a narrowing of the arteries that supply blood to your legs and feet. The mechanism is the same process causing heart attacks and strokes, atherosclerosis, which is the buildup of fatty plaques inside artery walls. When those arteries in the legs narrow, the tissues at the far end of the circulation, and your toenails are about as far from your heart as you can get, start to receive less oxygen and fewer nutrients. The nails respond by growing more slowly, thickening, and turning yellow or brownish, because the cells producing healthy nail tissue simply do not have what they need to do their job properly. Now, here is where it gets really interesting. The toenail changes in PAD often appear before the classic symptom most doctors ask about, which is calf pain during walking. That pain, called claudication, happens when the blood supply restriction is already significant. The nail changes can appear earlier when the restriction is still moderate. There was a study in the European Journal of Vascular and Endovascular Surgery that found nail changes in the feet were among the under-recognized early signs of peripheral vascular insufficiency, particularly in diabetic patients. What we know is that PAD affects roughly 12 to 14% of adults in the United States, and a significant proportion of them have no symptoms at all, or have symptoms they are attributing to aging or arthritis or just tired feet. They are not making a connection between a yellow toenail and cardiovascular risk. The second major systemic cause is diabetes. This one deserves its own explanation because the mechanism is actually more complex than most people realize. Diabetes damages your nails through two separate pathways. The first is the circulation pathway I just described. High blood sugar over time damages the endothelium, that is the inner lining of your blood vessels, causing them to narrow and stiffen. The small blood vessels in the nail bed are particularly vulnerable to this damage, and the result is impaired nail growth and color change. The second pathway is neuropathy. Diabetic neuropathy means the nerves supplying the feet are progressively damaged. When nerve signaling to the skin and nail bed is impaired, the regulatory mechanisms that maintain healthy tissue start to break down. Sweat gland function decreases. Skin integrity decreases. The nail bed environment changes in ways that can cause thickening and discoloration, even independent of direct circulatory damage. And critically, because of the neuropathy, people with diabetic foot complications often feel less pain in their feet. So the warning signals are quieter. There was a paper in Diabetes Care that found nail changes, including yellowing and thickening, were present in a notably higher proportion of diabetic patients with poor glycemic control compared to those with well-managed blood sugar. The nail is essentially reflecting the metabolic environment it is living in. If you have yellowish, slow-growing, thickened nails, and you have not had your fasting glucose or your hemoglobin A1C checked recently, that is a conversation worth having with your doctor. The third cause is lymphatic dysfunction, and this is the one that almost never gets discussed. Your lymphatic system is a network of vessels running alongside your blood vessels that drains fluid and immune cells from your tissues. When lymphatic drainage is impaired, fluid accumulates in the lower limbs. That fluid buildup increases the pressure in the tissue surrounding the nail bed, which over time compresses the blood vessels and disrupts normal nail growth. The result is what is called yellow nail syndrome, and it is a recognized clinical condition with a very specific appearance: slow-growing, thickened, yellowish nails, often with a slight curve across the width, and sometimes with the nail partially separating from the nail bed at the far edge. Yellow nail syndrome is rare but important to know about because it can be associated with chronic respiratory conditions, including pleural effusions, which is fluid around the lungs, and in some cases with lymphedema or certain underlying inflammatory conditions. If your nails are yellow and you also have swollen ankles that do not go down overnight, or if you have a history of recurrent chest infections, that combination deserves proper investigation. The fourth cause is psoriasis. Now, most people know psoriasis as a skin condition that causes red, scaly patches, but psoriatic nail disease is extremely common in people with psoriasis, affecting roughly 80 to 90% of people with psoriatic arthritis and around 50% of people with skin psoriasis at some point in their lives. The mechanism is an autoimmune one. In psoriasis, the immune system mistakenly attacks the skin and nail matrix cells, causing them to turn over far too rapidly. The result is a characteristic set of nail changes, including pitting, which is tiny dents in the nail surface, oil drop discoloration underneath the nail, which looks like a yellow-brown spot seen through the nail plate, thickening, and separation of the nail from the nail bed. What makes this important clinically is that nail changes in psoriasis sometimes appear years before joint symptoms develop. If you have yellow or pitted nails and unexplained joint pain, particularly in your fingers or toes, that is a pattern worth investigating because early treatment of psoriatic arthritis can significantly slow joint damage. The fifth cause is medication and nutritional deficiency. Certain medications, including tetracycline antibiotics, antimalarials, and some chemotherapy agents, can cause nail discoloration as a side effect. And deficiencies in specific nutrients, particularly zinc, vitamin B12, and iron, can impair nail matrix cell function and lead to color and texture changes. Zinc is particularly relevant here because it plays a direct structural role in keratin synthesis. The thing is, these are relatively straightforward to identify and address once you know to look for them, but they tend to get completely overlooked when the default assumption is fungus. So how do you actually tell the difference? Here is the practical guidance. Fungal nail infection tends to have a few specific features that distinguish it from systemic causes. True onychomycosis usually starts at one corner of the nail or at the tip, then spreads inward. The discoloration is often yellow-brown or white, and there is typically a crumbly, powdery debris underneath the nail when you try to lift the edge. The nail thickens and can become quite brittle. It usually affects one or two nails first rather than all nails simultaneously. It is also more common in people who use communal showers, wear occlusive footwear for long periods, or have had athlete's foot. Systemic causes, on the other hand, tend to affect multiple nails at once, rather than starting asymmetrically. The yellowing tends to be more uniform in color, rather than patchy. There is less crumbly debris, and critically, there are often other signs elsewhere. Cold feet, swollen ankles, fatigue, skin changes, joint pain, a history of blood sugar issues. These are the contextual clues that point away from fungus and toward something systemic. Now, the gold standard for confirming or ruling out fungal infection is a nail clipping sent to a lab for microscopy and culture. This is a simple, inexpensive test that your primary care doctor can order. If you have been treating presumed fungal nails for more than a few weeks without improvement, please ask for this test before continuing treatment. It will tell you definitively whether fungus is present. Let me give you the practical framework now, because this is where it becomes actionable. Step 1. Look at the pattern. Are one or two nails affected asymmetrically from the tip or a corner, with crumbly debris? That is more consistent with fungus. Are multiple nails uniformly yellow or thickened without debris? That is a reason to look systemically. Step 2. Do a basic self-assessment. Feel your feet. Are they frequently cold, even in a warm room? Press on your ankle. Does the skin pit, meaning leave a dent when you press and release? Both of these are signs worth investigating with a doctor. Have you had your blood sugar tested in the last year? If not, ask for a fasting glucose and an A1C at your next appointment. Step 3. If you have any of the systemic features I described, cold feet, ankle swelling, joint pain, unexplained fatigue alongside the nail changes, book an appointment with your primary care physician. Tell them about the nail changes and the associated symptoms together. That combination gives your doctor a much clearer picture than "I have yellow nails." Step 4. Do not self-treat for more than 4 to 6 weeks without a confirmed diagnosis. Over-the-counter antifungals are not harmful, but taking them for months for a condition that is not fungal means the real cause is going untreated for months. If the treatment is not working, that is information. Act on it. Step 5. If it is confirmed fungal by lab testing, commit to treatment properly. Topical antifungals require daily application for 9 to 12 months for toenails because toenails grow very slowly. Oral antifungals, which your doctor can prescribe, work faster but require baseline blood tests to check liver function first. The recurrence rate for fungal nails is high, so prevention matters too. Keeping feet dry, rotating footwear, using antifungal powder in shoes, and treating any residual athlete's foot are all part of the long-term strategy. Let me leave you with the bigger picture. Your body communicates constantly. It does not wait until something is dramatically wrong to start sending signals. It starts quietly, in small, easy-to-dismiss places. A yellow nail, a bit of ankle swelling, cold feet at the end of the day. These things feel like nothing. They feel like just getting older, or probably nothing. But every single year, people arrive in emergency departments with advanced peripheral arterial disease, undiagnosed diabetes, or progressed psoriatic arthritis that had been sending visible signals for years before the crisis. The single most important thing I can give you through this channel is the habit of paying attention to those quiet signals, not with fear, but with curiosity. Because the distance between a yellow toenail and a conversation with your doctor is about 5 minutes of your time, and that 5 minutes, in some cases, changes everything. Thank you so much for watching. If this was useful, please subscribe and share it with someone who has been ignoring a yellow nail for longer than they probably should. Leave a comment below. I read all of them, and I will see you in the next one.